Hi, I'm Maddie Hamp, a student in the Masters of Athletic Training program at Ball State University. Today I'm going to discuss the disablement model using an injury as an example. Hi, I'm Maddie Hamp. The injury I'm going to use today is shoulder impingement syndrome. First of all, let's talk about what it is. Shoulder impingement syndrome is when the acromion continually rubs against and pinches the rotator cuff, causing irritation, pain, and swelling. What are some of the causes of shoulder impingement syndrome? Repetitive activity, overuse, inflamed bursa, or bone spurs on the acromion. Some of the signs and symptoms include pain when extending your arms above your head, pain lowering your arms from a raised position, tenderness on the anterior of the shoulder, achiness, pain lying on the affected side, and pain when reaching behind you, and stiffness when waking up in the morning. We are going to talk about how shoulder impingement syndrome presents in a patient. So today the patient presents with decreased shoulder range of motion when lifting above the head and then lowering their arms from the raised position. They also have decreased range of motion and pain when reaching behind their back. The patient presents with weakness and decreased strength when performing special tests, and the patient is also tender over the anterior aspect of the shoulder and presents with swelling. The diagnosis for the patient is right shoulder impingement syndrome. This is because of the limited range of motion. The patient has weakness and cannot perform certain movements without pain. So this is when the rotator cuff in the shoulder gets swollen, which leads to the rubbing against the acromion. There's no space left between the rotator cuff and the acromion, so the patient experiences pain and irritation. When asking the patient questions about their health and their activity limitations, the patient said that they injured their shoulder while playing tennis with the kids. He is also a high school tennis coach and needs to be able to play tennis. He cannot play because of the pain and the weakness, especially when doing overhead movements. The patient also has difficulty performing exercises, doing sports, and completing household chores, such as painting or cleaning the gutters because of the pain and the irritation. Although the patient expresses concern with some activity limitations, he also describes that he can still participate in certain activities, such as walking and helping cook. He can still work his day job as a salesman sitting at a desk without any pain or irritation. And he is still able to coach his tennis team from the sidelines because that does not require any overhead movements. Although the patient Also, when asking questions, the patient explains the environmental factors that affect his injury. This includes playing with his two young kids, whether on the tennis court or off, and the patient would also like to participate in household chores, helping his wife around the house with the kids, cooking, cleaning, etc. The patient also plays in a weekly golf league, and he would like to be able to continue playing without pain while going through the motions of his golf swing. The patient has private health care provided through his employment as a salesman, so therefore he has good health care to help him come see the doctor for his appointments. Some personal factors of the patient is that he has no previous shoulder injuries in either of his arms. He is 35 years old. His family has a history of arthritis, and the patient has no previous experience seeing an orthopedic specialist or surgeon. The patient does not smoke, but he does drink daily. This information was discovered by having the patient fill out an HRQOL to help get a better understanding of the patient's goals and risk factors. While talking to the patient, we also discussed a treatment plan, education, and prevention. To start off, we're going to give him at-home exercises and write him a script for physical therapy to help with his strength and range of motion. We also discuss continuing to ice and rest, continue to take NSAIDs such as ibuprofen to help with the pain and inflammation. This all can help with swelling as well. We also ask that the patient avoid any overhead activities to prevent any further irritation. If all these don't work, then you may see a specialist, an orthopedic surgeon, to discuss his surgery options. We also discuss prevention to keep it from happening again, especially to the other shoulder. We are going to work on improving his posture with physical therapy and at-home exercises, and also overhead muscle training. Examples are overhead presses. We also want to encourage him to rest and ice on any early onset symptoms of shoulder impingement syndrome. We also looked over his risk factors. If he has repeated overhead motion of his arms, such as when playing tennis and serving, that is considered a risk factor. He can also get arthritis due to the bone-on-bone rubbing and also his family history of arthritis as risk factors. In conclusion, we can learn that athletic trainers can use the disablement model for clinical outcomes assessment to further treat the patient as a whole and examine the quality of healthcare the patient is given. This is done by having the patient fill out questionnaires and answering our questions. This can include an HRQOL. The disablement model creates a framework and foundation for evidence-based practice. This is to help the healthcare professionals serve their patients better and get a better understanding of how to get the patient to everyday life and reach their goals.